day, everybody, and welcome back to Doc Talk. I'm Dr. Darrell Wolfe, and today I have with me two exceptional people. I have John Kilik, and I have Robin Senyk, and guess what? They're a team, okay? You know that saying, teamwork makes the dream work, teamwork makes the healing work. Well, in this case, I've asked them to come in today because I wanted to talk to them about the power of when two come together, and especially when you are a couple. And when it comes to building your dreams, coming together, and you have the same passion and the same purpose on how that all comes together. Hi, John. Hey, Robin.
Hi.
How you guys doing?
Good.
Excellent. Yeah.
Okay. So, Robin, you first decided that there had to be changes in your career or in your life. And then, John, you kind of started a little bit behind her, but I guess it's everything happens for a reason.
Absolutely.
Why don't you tell us about your story, and then John, I want to hear about yours. And what we want to do today is I want to show you something, and I want to tell you something that is all about the dream team, and it's all about moving forward with your passion. You're going to find out that these two have come together, and they have an unbelievable clinic happening, okay, where they have people coming for personal treatment and trainings from all over the place, and where they get couples coming, families coming. They do emotional counseling, nutritional counseling, detox programs, and you know what else? They actually look after the people that other practitioners can't. And I will prove that to you today when we just have our get-together here and we just talk about what they're doing and what they've accomplished. Robin?
Well, me and John have always worked together. We had a couple businesses, and we've always been together. But what really we were in the oil field in our last business, and we did that for about 13, 14 years. Yeah. And we were on the road all the time. It was great that we were together, but I mean, that's all. We were just together.
Yeah, that's right. Yeah.
Hey, and
together, but not together?
Exactly. We
just
were
working.
physically together.
Physically in the vehicle together.
Yeah.
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 Right.
And I really started getting tired of it. I knew something different had to come because, I mean, it was just the same thing every single day. And that's it. There was no goal. There was no ambition. It was just go to work. That's all we did. And I was done. I needed something different. But it took me a couple years to finally say I'm done. So I had found Darrell actually on a symposium that you were talking.
Can I say something?
Yeah.
So being done, okay. Am I right or wrong? Just say if I am. But it doesn't matter how much you love someone if your life is boring.
Correct.
Absolutely.
Absolutely.
Okay?
Yep.
Yep.
It's, you know what? And people need to get that. If you don't find your passion, you don't have adventure.
No.
And I found that we really lacked that. We were just two bodies that were together. And I thought we had an amazing relationship.
Well, you did compared to the other abusive ones.
Yes.
Right. Yes. And everyone.
And I don't mean abusive. Like, I just meant we don't know. It's abusive when you're not living your purpose and your passion.
Yeah. Yeah.
Well, come on. Everything is about fun. I mean, or joy or creating happiness. I mean, God, we have a bowel movement just to be happier. I mean, if you don't have one, how do you feel?
Pretty shitty.
Yeah.
Pretty shitty. Okay, all right. Oops. Okay, oops, poops. Okay. So tell us about your story.
Okay, so I found Darrell on a symposium that he was talking on through the truth about cancer, and I had kind of dabbled a little bit in the whole emotional part of it and how it was. You learn how emotions got trapped in the body. It was just the beginning of it. It never really explained things, but when I heard Darrell talking, and I'm like, this guy, no, he's saying it. There's no fluffy stuff. It was right to the point, and it was exactly what I wanted. So I signed up for more so the physical, the body work part of it. And I knew, I'm like, there's an emotional class with it. Yeah. There's always, everybody thinks they can teach an emotional class, so I just kind of passed it off as being nothing. But when I came here and went through the whole 3 weeks, it blew my mind. Scared me, but it was just so empowering. And I knew that this is what I want to do. I want to go on this path, because it just started a fire inside me, and it was just something totally out of the box that I was never exposed to, really. So that's kind of my story.
Well, you know what? You got to stir it up. You got to shake it up. And if you're not ready to stir it up or shake it up, you're not going to find what you want.
Yeah, and one thing I really struggled with was we just did the same thing every day because it was money. We did it for the money, and it was great. I mean, we had money, but I was so bored with everything, and I had no passion, no goals, no nothing. And I knew, I'm like, I can't continue on living this way. This is not where I want to be.
Well, there's a genius in everyone, and you can have all the money you want if you find your passion and you deserve it. Your value is your value.
Yeah.
And when you've got low self-esteem, you've got low value.
Mm-hmm.
Yeah.
Oh, yeah.
So did you find, so it doesn't have to be an exchange. You don't have to sacrifice happiness for money. They can come along together.
Absolutely.
And you guys have proven that
Yeah.
with your clinic. It's so successful. Yeah. And you know what? You're up north. They're up north. Okay, they're up north. I'll say that again. Okay, with the Bears. Okay, where's your clinic again?
So we're located in northern Alberta in a small community. Our town is called Valleyview. There's not very many people. I think it's 2,500 people.
About that, right in the town.
In the town, yeah.
And they're smoking busy. Go
And we're
figure
busy.
that. Okay.
Yeah.
Okay. So what's your business called?
It's called Frequent Vitality.
Okay. All right. And so that's frequentvitality.com if you want to check it out too.
Yeah.
They have a website.
Yeah.
So what do you guys major in the clinic right now? Like, what do you do?
Lots of deep tissue.
Yeah.
Lots of people only want to do the physical, but we also do a lot of things. We do the nutritional, because that comes along with it, the emotional as well.
Yeah. And we do the nutritional and emotional workshops.
Mm-hmm.
Yeah.
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 So it introduces people to what we do and enlightens them on the possibilities that they can do this themselves.
Yeah. And for those of you that are listening, let me explain what deep tissue is. For one thing, when I put this together, and I did put this together, let me see. Let me do the calculations here. So I put it together about 35 years ago. So the reality is, that's when I started to. It's called Wolfe Deep Tissue, and don't think it's not deep tissue.
Yeah.
So what you think it's deep tissue, I've had deep tissue before. Well, understand something. With this technique, we use our elbow in a loving way. I'm not saying that it always feels good, because what we do is we actually go in, and the calcium that's been pulled from your bone is in your tissues. It's in your organs. When somebody says, I have osteoporosis, they have osteoporosis or osteopenia. That calcium did not leave the body. It's still in the body. And it's hardening up all the tissues, the tendons, the ligaments, the muscles, and the organs. And that's why, Grandpa is as stiff as a board. But he's also stiff as a board because we don't realize how fearful we are.
Mm-hmm.
And we're always running programs. And those programs, if you are in a relaxed, safe state of being, then you're dumping hormones that are healing you. If you're not, you're dumping hormones that are ripping your muscles apart. They're creating inflammation, which causes crystallization, scar tissue formation, and even that calcium draw. Okay, so all of that is happening. So when people say, like, when I first got out of high school, okay, I wanted to become something that had to do with health. So I went and I became a registered massage therapist. Now, please understand something. Everything has its place, but that's using your hands, okay? It's using your hands. It's effleurage, petrissage. It can be trigger point therapy. But understand, your hands grow insensitive, and your hands cannot feel calcium deposits, cannot feel crystallization properly, and they cannot pull fibers apart. If you understand something, everybody says, oh, I've got a knot here, or a stiffness in my knee or my ankle, or I'm going to have to go for hip surgery. Well, all that is scar tissue and crystallization and calcification. And understand something. You may not realize this, but you guys are already realizing it with your patients, as we were talking earlier about them, how they've got patients now coming that are booked for hip, knee, or even spinal surgery that they end up not going, right?
That's correct. Yeah.
Yeah.
Yeah. So understand, and I'm not telling you not to go, like they wouldn't either.
No.
But the reality is why don't you try something before you try the knife? And understand something. Don't give up on your body, like you guys tell all your clients and patients. Don't give up on your body. Give your body a chance first, because your body actually, when they say it's bone on bone, it's not. It's actually the muscles, the tendons, the ligaments actually get calcified. But soon as you go in there and you use a special technique called Wolfe deep tissue, we're going to gently unknot the knots and bring those fibers apart to allow the blood, the lymph flow to go through, and that allows the energy to come in, and your body will heal itself. Let me tell you, I'll come up against any surgeon anytime they want to come on my show, and we'll talk about it. Because I'll tell you right now, 95 to 98% of all surgery does not have to be done. Okay, it's because the care caused them to go chronic because they never ever got the proper care to do self-care. So if you've got no prevention, and that's where you guys come in, right, with your
Absolutely.
people coming for PTTs,
Yep.
coming for trainings from you, or even when they come to get deep tissues, your focus is on training more than treatment, isn't
Exactly.
it? Right.
Yeah.
You need it. You can't just expect me to fix it and then that's it. You don't do anything to help yourself. So I make sure that people understand, there's a lot more than just me working on you.
Yeah, and don't get me wrong, but it's like this. You can come to John and Robin, and they're going to give you a money-back guarantee, not because they want your business, but they want you to understand that once you pull the scar tissue apart and you get the calcium to be free-flowing again, and you bring up the heat, the temperature, the blood flow, the crystallization melts and the body heals itself. That's the deal. And then you can say, well, yeah, but I was told by my doctor there's nothing they can do. And I'm going to tell you, they're absolutely right. There's nothing they can do. But how often does that happen? And they'll call you up and say, look, I don't want to go to surgery, so what do you think you can do for me?
Yep. We're
Yeah,
like,
it happens on a regular basis. We had one gentleman really comes to mind. He was 77 years old, very active, horseback riding, roping, and he was having some knee issues from years of use, and they were going to do surgery. And we happened to be talking to them one day at the grocery store, and he actually asked a few questions on what we do, and he came for 3 treatments, and he canceled his knee surgery.
Yep.
And he's back to being active and physical and
no pain.
and he got some power back. He's got some of his life back. So
Yeah.
it's very, very empowering to do that.
And as they'll tell you, surgery causes the worst scar tissue in the human body.
Yeah.
So if you have to have it, you have to have it. But even if you go to scar tissue, if you go to surgery, you've got to come and see them.
Yeah.
So 6 to 12 weeks later, depending on your healing capacity.
Yeah.
You guys see a lot of women that have had cesareans,
Yeah.
breast operations, rotator cuff problems, carpal tunnel syndrome. Earlier, before we came on the show, they were talking about how people have had surgery on their ankles, and then one lady had scar tissue all wrapped around the screw. The screw is actually popping out, and they just went in there for half an hour, and she was able to walk again and go cross-country skiing. So if you want to avoid the actual surgery, or if you've had it, those are things that you need to really take a look at.
Yeah.
Right?
That's right.
Yeah.
And even though they've had surgery and a repair has been done, there's still not only the damage from the scar tissue from the surgery, there's still the original scar tissue from prior to the surgery.
Yep.
And then how many people actually have to go back in for surgery from the surgery to remove the scar tissue
Yeah.
from the surgery?
Yeah.
So you can get that removed without surgery. I hope you know that.
Yeah.
And we do it on the abdomen. We do it on the breast. We can do it on the pelvis. We can do it anywhere on the human body.
Yep.
Right?
There's no limits.
Yeah, no
Yep.
limits.
There's no limits.
Yep.
Right. So you started and opened your business, about a year and a half, 2
Year
years
and a
ago?
half, yeah.
Yeah,
Yep.
year and a half, 2 years ago.
Yep.
And when you first started, how did you feel about it? Like, how did you feel it was going to work? Especially in a population of 2,500.
Yeah, I wasn't too sure how it was gonna go. I'm like, how do I explain to people? You know, it's not massage. You know, it's something different. And I did have a couple friends that, you know, they were like, okay, I'll give it a try. And that's what happened. It was the word of mouth. I haven't really done much advertising, but yet I'm busy. And that goes to show if you do a good job, your word of mouth will do a lot for you. So.
Yeah. And understand, like I said, therapies have their place. They all do.
Yeah.
Yes.
Okay, you can get a chiropractor can align you, but they don't get the scar tissue out between the vertebrae. And understand something, it's the scar tissue that pull the vertebrae out. And understand this, that you can get acupuncture. I have a doctorate in acupuncture, but you can try to move the energy, balance the energy, but it's still the scar tissue. If you don't remove the physical blocks in the body, okay, they are what cause the problem. That's why, you know, people don't actually get older. They just get more scar tissue, more crystallization, more calcification, because of the lost calcium in their bones from the acidity. And the thing is if you don't want to just get treated, because you guys do a lot of trainings, don't you? Like you'll bring on a couple for 5 days. Like you have people that come and they'll come to you for 5 days, right?
Yeah, that's correct.
And they'll go into more of an intensive training called a personal treatment and training.
Yes, and we're fortunate. We live in one of the most pristine natural parts of northern Alberta.
Right.
And you know, we have hiking trails and walking trails, and there's no noise of any vehicles or the street noise. It's the noise. It's
No EMFs.
no EMFs. When you look out our front window, all you see is trees and a river valley. There's no other houses. It's really pristine.
It brings it back to nature.
Exactly.
And
yeah.
a lot of people need to
Just calm down and realize what's out there.
Yeah. And then you're doing a lot of what's called the perfect pain-free pregnancy, and you're working and teaching women who want to get pregnant and women who are pregnant that they don't have to have stiff hips, back problems, knee problems, ankle problems, digestive disorders, right?
Yeah, and it's amazing just going in there and freeing up the hips, how much better. Like, I mean, people with having a baby, they're so much back pain. And yet, you know, you feel for them, and it's like I can help you. And you get in there, and it doesn't take very long, and it doesn't have to be very.
No, and it's not always the woman's fault either. The guys, you know, with nutritional, the diet, the emotional side of it, it's always a team effort.
Yeah.
So.
It's really great that you guys have really embraced the training side of it with all the people that come to you. I mean, I know you do great treatments, but
I think that you should be able to work on each other. You know, everybody is taught to go to somebody to fix you, but yet you can fix yourself. And why can't your husband work on you?
Yes.
It doesn't have to. You don't have to go pay somebody to do it for you.
Yeah.
When your husband is right there, he can help you.
Yeah.
And you were telling me earlier, too, that you put together a program that actually is about a 6 to 8 hour training for them to be able to go in and actually work on their pelvis area, their abdomen, and learning how to go in and for the husband to go in and work on the wife's breast so she doesn't get fibroids, calcification, or crystallization in there.
Yes, absolutely.
I mean, that's a super duper protocol, Robin.
Mm-hmm.
Yeah, really good, really good.
Thank you.
So how does it feel to work together?
Oh, it's amazing to.
I mean, I knew you worked together in the truck.
Yeah. Yes, and you know, when we first started our first business, it was you know, we always talk about doing a job that you're passionate about, and yes, we had.
You were passionate about it then.
Yeah.
Right.
Yeah, we were, and but that passion, you have success. You have over the years of building up something that you're passionate about. It always comes to a point where you think you've hit the end, and that end should never end. It should keep going. But as you do the same repetitive job over years and years and years, you get stale, you get stagnant, and it's just that same thing, and that's all you're focusing on. Your blinders come up, and there's no other sense of direction. And you know, after Robin got back after the first time, she took the the whole life coach and the deep tissue, she, I always battled with sciatica, and the doctor said I had bulging disc, and it's going to end my career, and it's the same old scenario. And when I was a little bit on the fence with Robin going to take this totally out of the box course, and she came back, and I'd been going to the chiropractor for every 2 weeks for years, and within 45 minutes to an hour, I had instant relief, and I was convinced that right at that moment that yes, this is powerful, and this is.
I hope you're getting this. This
and
is a scar tissue issue, everybody, and it always is.
Yeah.
You know what?
Yeah. And from the years of driving in the vehicle, and every oil field farmer, log worker in northern Alberta, northern BC can relate to what I'm talking about.
Every one of them are crippled up.
Yeah, they got the sore lower back from sitting in the truck for 8, 10, 12, 14 hours a day for endless amount of days, because
and the crappy diet that goes around.
Diet that goes with it, and it just builds up, and the toxins are there, and you need to get rid of that.
And you can.
And you can.
It's
simple. It's not surgery. It's not acupuncture, things like that. Them all help, and they'll keep the dial turned down on the inflammation, but it will never get rid of it. Yeah. Whereas the deep tissue will. The Wolfe deep tissue will get rid of that.
So, it's like this, and I hear it, I've been teaching since I was 27 years old, deep tissue. So, doing this course, training, and it's the same thing. You might find it hard to believe out there, but the reality is you can get people that have had 40 years of training and went to school for 20 years, and then you can have one of my therapists that have gone to me for 21 days. And, that's why I say that, every one of my therapists, or when they come to us, we have this thing that everybody says, you come to me, and if I don't give you more success in the first treatment than all the other treatments combined, then don't pay me. And we do this for a reason, and I make everybody, I make them understand that if you believe in what you're doing, then you need to create belief and trust in your patient client.
That's right.
Yep.
And that's the whole deal. People have lost trust, and I don't blame them for losing trust.
Yeah.
Because you keep losing pieces, you keep getting put on drugs, or you keep going to this therapist or that therapist, or a practitioner says buy this package, right?
Yeah.
Yeah.
And I'll maintain you. Yes, it turns the burner down, but what about turning the burner off? You know what? Forget pain management.
Yeah.
Yeah.
How about pain mastering?
Yeah.
Right?
Yeah.
And I think you guys get it, right? You
Yeah.
got it, right?
Absolutely.
Oh, yeah.
Yes. Yeah.
Yeah.
I know that when you were first starting, you were kind of like, I don't know how busy I'm going to be. And then I'm sure I told you the stories. I told you what was going to happen.
Mm-hmm.
But how fast did you buy into it? You had to work for a while.
I did.
Until you had people feed back to you, right?
I went out and I'm like, I have to do this. I'm not going back to what I came from. So I have to do this. And I forced myself to do it. But deep down, I'm like, I was scared. I'm like, I don't know, and I mean, I'm not saying that the first day that I opened the door and I had people coming in, there was a couple, but I didn't let anybody know that I was there. So are they going to come? Because in a way I was scared. I was like,
you're not going to let people know, because at least if nobody comes, you're still a success.
Exactly. But over time, like I said, I had a couple of friends that, I'll give it a try. And from there it grew to they told a friend and they told a friend, and all of a sudden it's like,
now you're swamped.
Yeah, just the phone calls keep coming, and I'm so grateful.
Yeah.
For them.
Yeah,
and
but
for
see,
this and
what a broad spectrum from working on sports injuries to working on people in accidents to chronic health care to pregnancy to working with couples to teach them how to lovingly look after each other. I mean,
Absolutely.
that is...
Yeah. There's such a there's no limit to it. Like, it's not just one thing. It just goes everywhere, and then you get the nutritional with it and the emotion that goes with it too, and it's a whole body thing.
Yeah, when you have the foundation of wanting to give people's power back, it's unlimited because it's all about the giving.
Yeah.
It's about giving people back their power.
Absolutely.
And
yes.
why can't they have it?
They-
That it's just so wrong to have these people depend on someone else to make them better, and it's not up to that person to make you feel better. You can do it, and you have the power to do it, and it just makes me feel so good when somebody takes what I say and they have full confidence in themselves and they trust themselves that they can do it, and they do, and they feel so amazing. That's all I need. I feel so wonderful.
And like you were saying at the beginning, that about 30% of your clientele will actually come in for treatments and then say, "Hey, I want you to train my husband," or I want you to train me and my husband, or I want you to train me and my friend.
Yep.
That's good. 30% is good, but in time, more people are going to want to do this,
absolutely.
right?
And they
Yeah,
have
and
to.
they-
They need to.
They have to,
Like,
Yeah.
they need to take that power.
Yeah,
onto
families
themselves.
don't realize how crippled they are. You don't have to have a cane. You don't have to have a walker. You don't have to have somebody walking around the house with a limp or having a brace on.
Mm-hmm.
I mean, come on. I mean, as soon as we get rid of that victim mentality,
Yep.
right?
Yep.
And that's what we want to do. And we've been fed that. It's not your fault, but
Mm-hmm.
guess what? It's running rampant,
Yep.
So when you find people come to you and you work on them, how are they taking it? Are they following through in the things you say?
For the most part, yes. But I mean, you do get the ones that don't, and
So they just keep coming back.
they do. But then they're like, "Well, why isn't it working?" And I'm like, "Well,
Might be the alcohol.
yeah,
Yeah.
yeah.
The
Well,
chicken
like,
wings or-
look at what you're doing. It's not. Don't put this onto me. Look, let's take a bigger look at the bigger picture here. And then when they do, they realize that okay, it's
Yeah.
they have things they need to change.
But even
too.
though things may not be moving as fast as we'd like, I can guarantee you that we'll get more results with this therapy than anything else.
Oh,
guaranteed.
yeah.
Guaranteed.
But
Yeah.
somebody who wants to put themselves on fire, they're going to put themselves on
they're
fire.
gonna do
Yeah,
it.
that's right.
Yeah.
That's right.
Yeah.
Whether it's emotional or physical
Yeah.
or habitual, whatever that case may be.
Yeah. Yeah.
Right?
Yeah.
So, where can people go to see your website? And what's your phone number? And where exactly are you?
Where are we? We're
Yeah.
with the Bears.
Yeah, we're at the Bears. Yeah. Yeah, so we're in Valleyview, Alberta,
Which is where?
Which is in northern Alberta.
Which is where?
Our closest big city to us is Grand Prairie, Alberta. So it's about an hour away from.
So can I fly into Grand Prairie?
Yep, you can.
Yeah,
Okay.
Yeah, and that's what people do. They'll fly into Grand Prairie. They can rent a car.
Yeah.
There's in Valleyview itself. There's a hotel they can stay at, or we have accommodations out at our farm where we live. We
Yeah.
don't live right into the town of Valleyview.
Yeah.
And it's we go over the nutritional.
So they can make an adventure out of it.
Oh,
so.
absolutely.
Yes.
So not
Yeah.
only they come for a real adventurous holiday,
Yeah. Yeah.
right?
Yeah.
And it doesn't necessarily have to be a physical adventure. I mean, if you just to be in nature and just take it in, because a lot of people lack that going back to nature and just enjoying it and taking it in.
And then
A lot of people
you'll
never-
teach the things they want to know, like how to eat,
Yeah.
maybe touch on their emotional,
Mm-hmm.
Yeah.
Absolutely.
right? Go
yeah.
and do some gentle work, or if they need things turned around, you'll do it, right?
Absolutely.
Yeah.
Right.
So we're our business is Frequent Vitality. The website is frequentvitality.com, and the phone number is 780-524-8825.
So what would you like to leave them with?
Well, I want you to know that you can take the power back for yourself, and it's your responsibility, and you deserve it. You deserve to live a healthy life, and you deserve to live a life that is to its fullest. Whether it's through nutrition, whether it's through emotional, or through physical as well, you deserve it, and I want to teach you how you can do it.
Beautiful.
Yeah.
John?
What I want to say is, don't compare yourself to how you compare to other people around you, or the people that are in your environment. You need to create your own environment that's brings your frequency higher, brings your focus higher, and gives you that empowerment that you are unlimited. All you got to focus on is improving yourself 10% every day, or every step that you take. Improve yourself, and if there's no limit, you can go anywhere.
Yeah.
You can do anything you want.
There you go. I want to thank you both for coming here, and I want to thank you both for your bravery, and I do mean that. You know what? How many people have thought about living their dream, living their passion, and it's still on the sidelines? How many people are willing to walk away, and you don't have to completely walk away, but to actually say, okay, I'm going to take my holiday time and go check out my passion, and that I think is my passion, which could be my purpose, and then I'm going to see if I'm going to do that. At least do it. You know, it's that first step, like you just said. Just take that first step. How many people will continually stay on drugs, numb themselves out, okay, and then eventually you're going over there and you're going to get the knife. There's nowhere else you're going to end up. And you're going to end up with a limp, then a cane, then a walker. Or you can make a phone call and just try something that hardly anybody else tries, and then maybe be very pleasantly surprised.
Mm-hmm.
So, what's your website called again?
FrequentVitality.com.
FrequentVitality.com. Check it out, and thank you for joining us. And just know that I do Q&As every Monday and Friday when I'm not traveling. Check it on Facebook, Instagram, or YouTube. And you can send your questions in live when we do them. We do them at 3 p.m. Pacific Standard Time. And just know this. Your questions matter. So if you've got questions, call us or call John and Robin, okay? Especially if you live up in their area, just give it a shot, okay? Give yourself a chance, all right? Because guess what? There's a better way, there's a better life waiting for you, okay? Ask yourself, what do you truly deserve, okay? And then take it even higher. Thank you for joining us, and God bless, and have a beautiful night.
Thank you.
Thanks.
If you're looking for life-saving and life-changing information, well, you've come to the right place. Don't forget to click and subscribe. Stay connected.